idea how much this chair helps my back.
Yeah.
If I could sleep here, I would. Taking all this weight off my breast from my back. I'm feeling awful this morning. My name is Shayla, and I am cuckoo for breasts. I love breast implants, and I love big breasts, but they cause me back pain.
I think so you'll be more sexy with and medium boobies.
John, you like little boobs, like an orange.
Just not little
I like
boobies.
melons.
Watermelons?
Watermelons. I just like big boobs. I grew up in Brazil. I was unhappy with the way I used to look. In 2001, age 21, I started going under the knife every 6 months. It became a habit. It was like going to get my nails done in a nail salon. I think I was something wrong with me. I think I was cuckoo crazy. I have had 32 plastic surgery in my breast. I had all the cc's you can ever think of. I had 145 cc's, 245 cc's, 345 cc's. I had 555 cc's, 650, 850, 1200, and 3500, and 5500. After that, I didn't want to stop. I still want to go bigger. My goal were 8,000 cc's. But unfortunately, well, I had a blessing. I got pregnant. So that stopped me a little bit. The doctor said, you have to go back to this size because you're gonna breastfeed. So got my breast reduction from 5,500, I went all the way down to 750. So after Victoria was born, a healthy little girl, I went back to Brazil and I say to the doctors, can you please make me bigger again? I cannot live without my breast. The implants that I have right now is the 2,500 cc's. I'm gonna miss my twins. I'm gonna miss them so much. But it's time for them to go. It's time to retire the boob business. In 2017, I started developing chronic back pain. And I'm sure this has to do with those unnecessary weight carrying around. A couple of years ago, if you ask me, Shayla, go small, I would say, you know what? No. You're crazy. But today, I'm ready to have a reduction. If I can have my breasts reduced, that will be a big help for my back and to, make it look better. But the smallest I can go is 1,000.
I can't wait to see you with our new boobies.
Oh my God.
Okay.
I'm ready to look sexy.
Shayla.
Hello.
So where are you guys from?
Brazil?
Is that where you've had most of your plastic surgery?
Yes. I want the big breasts, tiny waist, but my doctor told me I had to do a couple surgery to get that size because I was flat-chested.
Okay. So what did they put in the first time?
145.
That's very, very small.
Very, almost like a baby breast.
Yeah. How long did you wait before you went to the next bigger size?
I was like every 6 months.
Surgery every 6 months, that's not something I would recommend. The more times you have surgery, the higher the frequency of encountering a surgical or anesthetic complication.
So then, after that, I had to have a special implant to make.
And how big were those?
5,500 cc's.
Wow.
But I was pregnant and I didn't know.
Okay.
So I had to go back into surgery to reduce the implants.
So then you delivered and you go back in and have big ones put back in again?
I wasn't able to get those implants that I had custom made. They no longer fabricate those implants. So he took a 1,500 implants and stacked 2 in each breast.
Okay.
I told them, this is so common in the United States, they do all the time.
Stacking?
Yeah, I lied.
Yeah, you
to
lied.
get away with my big breast.
Okay.
So I show him a little video from Deep Talk because I seen that on the show.
From the TV show.
I know.
That's fiction.
That's fake.
So you convinced him based on fiction. The fact that Shayla was able to convince a plastic surgeon to do something unorthodox by showing him a video tells me 2 things. 1, she's very persuasive, and 2, must have been a really good show.
Those double stack implants was so swollen, it was infected. And the incision was very
Red.
blue.
Blue.
It was turning blue.
Oh, you know what that
And
means. Blood
so-
supply's not good.
Yes, I cried. It's like I was dying. The area inside my breast was black.
Yeah.
Complete. So I had to remove crafty skins from the side and leave me without the implants. So when I walk out and I had no implants, and you already know what happened now.
You freaked.
I freaked out. I didn't look in the mirror for a long time.
I'm really interested in helping Shayla. The problem is that when you take a patient who's had a history of so many previous operations like Shayla, it makes you wonder whether you can ever truly make her happy.
And then they put it in.
So that was the last surgery.
This was the last
How long
surgery.
ago?
2012,
So what are your goals now?
1,000.
Why do you want 1,000?
With the 2,500 now, it was okay, it was fine. But 2017, I was working in a psychiatric hospital. I was doing program with the patient. He got out of control, and he grabbed me, threw me across the room. So I landed on my back, and then I got back pain. So the breast became an issue.
So now you have a functional issue.
And I have this big gap, and you're gonna see later after we exam, you're gonna see the defect. My breasts are deformed. They don't even look normal anymore.
To take the weight off will require a lot of skin removal. The question is, how risky is it? All right, take a look. Okay,
It's a mess.
okay, let me see something for a second. Are you sure these are 2,500 cc's? They seem a little smaller than that.
My doctor told me 2,500.
Okay, that's okay. So, all right, you do have some breast tissue hanging off here. We call that a dissociation. But the good news is you have a lot of breast tissue. It's pretty thick.
good.
Although I have several concerns about a patient who's had 32 previous breast surgeries, the main focus is on blood supply to the tissue and how much internal scarring there is. This is what could be done. We could take the breast implants out.
Okay.
We would have to close down the pocket to put a smaller implant.
Okay.
If we don't close down the pocket, they'll just fall down into your
Yeah,
armpit.
please do whatever you.
So you have to close down the pocket, put the new saline breast implants. Whether it's 800, 850, or 1,000, that's all about the same. And then 1,000, and then you're gonna have a lot of excess loose skin, correct? So that has to be removed and everything has to be tightened up. So you need a significant breast lift. I think I sort of have to take your case because this is very high risk and I've done this
He's
before a
gonna
few
do it.
times. The number one goal is to take care of the pain and the functional problem. The number two goal is to make them look good.
Yes,
And once he does this, you're gonna be a lot smaller. Are you sure mentally you are ready for this?
I am 100% ready. I can't wait.
Hi, Shayla. How are you? Good to see you. How do you feel?
I feel a bit nervous.
You do?
Yeah. Today is my 33rd breast surgery. I have mixed emotions because honestly, I need to get a breast reduction, but I wish I could kept them. I love them.
Downsizing should relieve you of a lot of pain. Okay, so we think you have 2,500 cc's. It's possible that I get in there and there's not 2,500. In fact, it's possible I get in there and there's substantially less.
Okay.
If there's substantially less, I'm gonna have to work with what it is and what I need to go down to get enough laxity so that I could lift you up.
But my girl is 1,000.
So let me ask you this, finally.
I may freak out when I wake up.
Well, let me tell you this. I go in there, all you have left is an 800 cc silicone. If I take 800 and put 500,
You're gonna have crazy person
No.
getting up surgery.
hold on a second, Shayla.
Okay.
If I reduce you by only 300 cc's, you're still gonna have all that back pain.
What I want is 1,000, but if it gets there and 1,000 is not possible, you're the professional, you're the doctor, do whatever it takes.
Have you ever said this to a doctor before? The first time. Although I've operated on someone who's had multiple previous operations, this is the first time I've done someone who's had 32. This could be a much more difficult operation than I'm even suspecting, and I'm suspecting a very difficult operation. For Shayla's surgery today, I'm going to make incisions under her areolas and remove her old implants. Next, I will assess the breast pockets, downsize her implants, and manipulate the breast tissue and skin to give her a better overall cosmetic result. What's happening?
You know I'm angry.
Uh-oh. How are you? First of all, you're not happy.
I'm sad. I already cried so much.
Okay, let me ask you a question. What's upsetting you?
I saw the card. You sent me with the card, took care with me.
Okay, so you saw the card. So you're concerned that I took you all the way from 2,500 down to 560, right?
I'm feeling flat chested right now, and I'm very,
very upset. There is no way in hell that I will keep 500 cc's. 2,500 to a 500, that's a lot.
It is. But what if you had 1,060 cc's in this one and a little bit more in that one? How do I know? Because we measured it extremely carefully. Remember this discussion? I actually anticipated this possibility. Do you remember? I said, hey, what I've been thinking about, Shayla, is that what if I go in there and you actually don't have 2,500?
No.
We never spoke of that. It's possible that I get in there and there's not 2,500. In fact, it's possible I get in there and there's substantially less. I couldn't have done the lift. I couldn't have shaped your breast because it was too tight. In addition, you told me the reason you want to downsize them now is because you're having pain.
Yeah, but
So I did exactly what I needed to do.
I don't like 500 cc's.
These are just numbers. Forget the numbers.
But
Numbers.
no, I know, but can you still make these big a little bit more?
Don't go there. You had to have this operation. I assume that Shayla's previous surgeon knew she was obsessed with size, so that's why they told her what they told her. But that's not the kind of doctor I am. I want to relieve her of her back pain, but I'm gonna do that and tell her the truth. You're 20 hours out from surgery, you're already asking for bigger implants just because of a number?
Please, Dr. Dubrow.
Let me see what they look like.
They look pretty
Will you come
amazing,
here, my
like-
man? Take a look at that.
I don't want to look.
This part is more beautiful than before. Beautiful.
Look at the shape.
So it's beautiful.
Dr. Dubrow, please, put it more. Please.
Dr. Dubrow, he did the best job. When I saw her boobies, it looked great. It's amazing.
Dr. Dubrow, can you do me something? Make this smaller because
Hold on a
I
second.
used to have skinny, so now it's flappy because the implant was pulled.
Are you trying to talk me into doing a tummy tuck on you now to make your breasts look bigger?
No, it's just a lipo a little bit around here so my breasts look bigger.
You recover without a complication, and we'll talk about it. We'll talk about it.
I love you.
Okay.
Ciao.
Bye-bye. Ciao.
Thank you.
We don't know where she come from, but everything she do so cold.
It's been weeks since I had my surgery, and I had some unexpected results. I never thought that I would be walking around with a small breast like this. The last time I saw Dr. Dubrow, I was pretty upset. He said, heal, rest, recover, then we'll talk. Well, I'm healed, and I still have a lot to say to him, and he's gonna hear it.
Okay, all right, thanks. You expecting a Shayla, one of your patients?
Yes.
Uh-oh. Ooh.
I wanna talk to you. I owe you an apology.
Oh, this is gonna be good.
I'm rocking my world with my new breasts, and I love it. And
You love it.
I love it.
You're not totally unhappy.
I'm not, actually.
Okay, I can go on with my day now. I'm super excited that I actually got through to Shayla that huge breasts don't need to define her. Shayla looks really good, and I'm really happy for her, but much happier for me.
It was kind of like shock for me at the beginning. Then I came to realize how many doctors I've been through. And you are the only one that ever said no to me. And my back thanks you so much.
Your back pain's gone.
It's gone.
Oh, that's so awesome.
But I look so nice and beautiful. Before my surgery, my breast was a hot mess. They were disfigured and so large, they made my back problem worse. I was so obsessed with surgery and make my body perfect that I didn't realize the impacts was having my health and my life. But thanks to Dr. Dubrow, now my breast is the size that they should be. I love the shape and my back pain is gone. I don't need huge breasts to feel sexy anymore. I feel sexy. Let's go, Dr.
By far,
Nassif,
yeah.
because
Where am I going?
we have something to talk
Yeah,
about.
you're gonna go do a
What,
face.
the
Have a
back?
face of
Facelift.
consultation.
No, you're not. No.
Yeah, go for it. She's a great patient, really. I recommend it highly. Enjoy yourself. Bye.
I'll see you
Yeah, and I'll
next
see you again. We'll see you when I see you. Bye-bye, Shayla. See ya.